October is Breast Cancer Awareness Month. It's estimated nearly 40,000 women will die from breast cancer this year. Still, with a large number of people suffering from this disease, there's a lot of misinformation out there. So tonight, we have the top 5 breast cancer myths and the truth that you need to know. So here to help count us down is Dr. Alan Magaziner from the Magaziner Center for Wellness. Thanks so much for being here.
Thanks for having me, Lauren.
The big one that came out recently with so many conflicting studies is the mammograms and radiation.
You know, this area is never going to be cleared up in a few minutes here, but what I will tell you is that there is some exposure to radiation with mammograms, but that doesn't mean we shouldn't have mammograms necessarily. We have to be cautious with them, however. We have to be aware that the premenopausal breast tissue is very sensitive to radiation, and so I really feel that we need to do mammograms, but probably less frequent than we're currently doing them. There can also be false positives and false negatives with mammograms, which actually cause a lot of unnecessary biopsies. 4 out of 5 abnormal mammograms actually turn out to be benign. There is no cancer in these. So it doesn't mean that we need to do a biopsy on every abnormal mammogram.
We still want to encourage people, though, to get mammograms.
Yes, self-breast exam, have mammograms periodically. Maybe not every year, maybe go to every other year after a few might be normal. We also have to look at our diet, make sure we're eating the proper foods and doing the right lifestyle modifications, keeping our weight down, reducing our alcohol intake. These are all very important.
Right. Number 2, bras and antiperspirants can actually cause breast cancer.
Well, this one is interesting. There was a book written by a doctor, a Singer, and what he showed, it was an observational study, not necessarily a controlled study or a scientific study, but what he found is that women who were wearing bras more than 12 hours per day actually had an increased risk of developing breast cancer. And in fact, if they wore their bras 24 hours a day, and I don't know how many people do that,
right,
but if they wore bras 24 hours a day compared to those who didn't wear bras at all, the rate went up about 125-fold. So I'm not saying that bras cause breast cancer. They certainly don't. But we have to be aware that this might be one of the many, many factors.
The restriction.
Exactly. Restriction, perhaps issues with lymphatic flow. All these are important aspects.
Number 3, breast cancer is always detected by a lump.
No, not at all. Many people do not have lumps when they have breast cancer, and breast cancer might be, the first sign might be a discharge, might be nipple retraction, might be some what we call orange peel effect on the breast itself, change in texture or change in symmetry of the breast. So not every single breast cancer case will show a lump.
Okay, so that was our number 4, so we'll move on to number 5. Women with fibrocystic breasts are more likely to get breast cancer. No,
in fact, fibrocystic breast disease is usually a benign condition. And it's characterized, people have dense tissue, sometimes painful breasts, but most of the time these are benign. And frequently it's a sign maybe their body might be low in iodine, by the way. A lot of people aren't aware of this. Using some extra iodine may help reduce fibrocystic breast disease, as well as reducing caffeine and chocolate, and maybe taking some
But if you do have cystic breast, it can come up on a mammogram or an x-rays, and sometimes then they call for biopsies, and that's why, because the breast tissue is denser.
Absolutely, and it's hard to tell when you have lumpy and fibrocystic disease. You can't get a clear picture on the mammogram. All
right, Dr. Alan Magaziner, thank you so much for clearing that up. It's great information on this Breast Cancer Awareness Month.